Imagine building this impenetrable high-tech fortress. You've got satellite tracking, artificial intelligence, state-of-the-art biological security,
Right.
all these massive global networks designed specifically to keep the unpredictable elements of nature outside the walls.
Hmm.
You spend decades reinforcing the gates, but you completely forget to check the air vents.
Oh, yeah. The vents are always how they get in.
Exactly. And right now, international health agencies are scrambling because an invisible threat literally just floated through the vents of a luxury cruise ship in the South Atlantic. We built the fortress, but the real danger isn't, an invading army. It's a microscopic organism riding on a single speck of dust.
It really exposes this profound illusion of control that we operate under. I mean, we look at our smartphones and our massive skyscrapers, and we just assume we've insulated ourselves from the basic rules of biology.
Yeah, we think we're separate from it.
Exactly. But nature doesn't negotiate with civilization. It doesn't care about our borders or, our medical advancements. It simply exists. And occasionally an organism a fraction of a millimeter wide just steps in and reminds us how fragile those fortress walls actually are.
And that is the exact mission of this deep dive today. We are taking you on a really comprehensive journey into the biology of this current hantavirus outbreak.
Yeah.
We're going to look at how global health agencies are responding in real time and what this microscopic threat reveals about our deeply entangled relationship with the natural world.
It's a fascinating stack of sources we're going through, too. We've got CDC and WHO reports, medical journals, the Mayo Clinic, and some really insightful reflective essays.
Right. We are unpacking the exact mechanisms of the disease, the sort of psychological weight of modern outbreaks, and the invisible threats that surround you right now.
And the vulnerability of our highly connected world becomes just starkly apparent when you look at the specific cluster triggering this whole international response. I mean, it all centers around one single isolated environment, the MV Hondius.
Right, the cruise ship.
Yeah.
So the Hondius departs from Ushuaia, Argentina on April 1st. You have 147 passengers and crew on board. And they're embarking on this itinerary across the South Atlantic, traveling to some of the most remote, ecologically diverse islands on the planet.
Places like St. Helena and Tristan da Cunha.
Yeah, it sounds like this incredible adventure, right?
Yeah.
But you are hundreds of miles from the nearest major hospital, completely surrounded by the ocean.
Which is the perfect storm, biologically speaking, because ecologically diverse regions often harbor these ancient, undisturbed wildlife populations, and an isolated cruise ship is, it's essentially a closed-loop incubator.
Just recirculated air.
Recirculated air, shared dining spaces, tiny cabins. So on April 6th, which is just 5 days into the voyage, the timeline of tragedy really begins. An adult male passenger who had been traveling through South America before boarding starts showing symptoms.
And these are pretty generic symptoms at first.
Very generic. Fever, a headache, some mild gastrointestinal issues. At first glance, it just masquerades as a completely routine travel bug. The ship's medical staff treats it as such, but the physical decline of this patient is shockingly fast. By April 11th, he develops this severe, totally unexplained respiratory distress and dies.
Wow. Right there on the ship.
Right there on the ship in the middle of the ocean.
That is, the cascading effects from that single patient are terrifying.
Yeah.
Because a woman who was a close contact of that first man leaves the ship at St. Helena. She boards a flight to South Africa. And on that plane, her condition deteriorates so rapidly that she dies shortly after arriving at a hospital in Johannesburg.
It's just incredibly fast.
It is. And then another man on the ship shows signs of severe pneumonia, has to be medically evacuated to an intensive care unit in South Africa, and tests positive. Then another woman dies on May 2nd. So we're looking at 3 agonizing deaths, several suspected cases still on board, and the ship itself is suddenly rerouted to the Canary Islands to be held under strict quarantine.
And here is where it becomes a global crisis. Before this specific virus was even fully identified by the lab in South Africa, 30 passengers had already disembarked early and scattered across the globe.
Oh, man.
Yeah, you have people returning to the UK, to Singapore, and all across the United States. Health agencies are suddenly tracking and monitoring exposed individuals who just flew home to Texas, Georgia, Arizona, Virginia, and they're completely unaware of what they might be carrying.
See, it feels like we're watching the opening scenes of a disaster movie. How exactly do international health agencies track down dozens of people who are already dispersed across multiple continents? Because you can't just put out a generic APB for someone who might have a cough.
No, you can't. It
Mhm.
requires this massive, highly aggressive dragnet, which is coordinated under the international health regulations. Basically, when the alarm goes off in Johannesburg, the Argentine Health Ministry immediately shares the ship's passenger manifests.
Okay, so they have the names.
They have the names. And then agencies like the CDC in the US and the UK Health Security Agency, they start cross-referencing those names with international flight records, passport scans, customs data. They track the exact routes these people took.
And then what? They just call them.
They go further than that. Local health authorities are deployed to physically knock on doors in Virginia or Texas. They place these individuals under strict daily monitoring for symptoms and draw a 45-day quarantine circle around them.
Wow. 45 days.
Yeah, because they have to operate under the absolute worst case assumption, right? That every single one of those 30 people inhaled the same dust or had the same contact as the victims who died.
But wait, you don't throw a 45-day quarantine net over dozens of people across multiple countries for a standard hantavirus case. I mean, what is it about this specific strain that has the CDC and the WHO so spooked? Because we hear about hantavirus in the U.S., usually the Sin-Nombre strain, but that only transmits from rodents to humans.
Right, and that's the key distinction. The strain confirmed in this South Atlantic outbreak is the Andes virus.
Okay.
And the Andes strain, which originates in South America, presents a highly unique and incredibly dangerous biological challenge. Like you said, the vast majority of hantaviruses are strictly zoonotic. They hit a dead end in the human body. But the Andes virus is the only known strain with documented human-to-human transmission.
But really, how does that actually work mechanically? Does it, like, mutate in the lungs or something?
It comes down to how the virus replicates in human tissues. So, while the Sin-Nombre strain in the U.S. primarily attacks the endothelial cells deep in the lungs, which makes it incredibly hard to cough out viable viral particles, the Andes strain seems capable of replicating effectively in the upper respiratory tract and the salivary glands.
Oh, so it's much higher up.
Exactly. This means infectious viral particles can actually be expelled in saliva or respiratory droplets. Now, to be clear, the transmission is still rare. It generally requires very close, prolonged contact.
Which explains why the first two victims on the cruise were a married couple.
Exactly. A married couple sharing a small, poorly ventilated cabin. But the biological mechanism for human-to-human spread does exist, and that completely changes the mathematical model of an outbreak. Instead of just tracing who swept out a dusty barn, you have to trace every single person they breathe near on an international flight.
That is wild. And you mentioned a 45-day quarantine earlier. What is the virus actually doing in the human body for a month and a half before the person even gets a fever? Because the medical journals outline a progression that is just deeply horrifying.
It really is. The disease is called Hantavirus pulmonary syndrome, or HPS. During that incubation period, which can last anywhere from 1 to 8 weeks, the virus is quietly binding to receptors on your endothelial cells.
And those are the cells lining the blood vessels, right?
Yes, they form the delicate lining of your vascular system. The virus slips inside these cells and just uses their machinery to replicate. It doesn't destroy the cell immediately, so it flies under the radar. It just builds its numbers, spreading throughout the vascular system, completely undetected by your immune system.
So it's essentially setting up a massive ambush.
Exactly. When the patient finally feels that headache and fever, it's not because the virus is attacking. It's because the immune system has finally woken up and realized it is under a massive systemic siege.
And from the sources, it sounds like the immune system's reaction is what actually kills the patient. The body triggers this massive cytokine storm, about 48 hours after those initial flu-like symptoms worsen?
Yeah, the body just panics. It releases a massive flood of inflammatory proteins called cytokines.
Right.
Now, the normal purpose of cytokines is to signal white blood cells to attack the infection. But in a cytokine storm, the signaling goes completely out of control. This hyper-aggressive immune response degrades the tight junctions holding those endothelial cells together.
So the blood vessels actually start to lose their structural integrity.
Exactly. The capillaries, specifically the dense network of capillaries in the lungs, become hyperpermeable. They literally begin to leak blood plasma directly into the microscopic air sacs of the lungs.
It's like a panicked fire department showing up to put out a small fire in the kitchen, and their response is just to flood the entire house. The defense mechanism becomes the very thing that destroys the structure.
That's a grim but highly accurate way to put it.
And the patient's lungs rapidly fill with plasma, causing their blood pressure to plummet. Cardiovascular collapse follows quickly. I mean, One of the survivor accounts we read described the physical sensation as feeling like drowning while fully conscious.
It is brutal. A patient can walk into an emergency room complaining of a persistent cough, and within 24 hours, their lungs have entirely ceased to function. At that point, mechanical ventilation isn't even enough. Doctors have to resort to extracorporeal membrane oxygenation, or ECMO.
Which is an incredibly extreme measure.
It is the absolute last line of defense. The lungs are so completely compromised, so full of fluid, that machines have to pull the blood out of the patient's body through these massive catheters, artificially inject oxygen into it, remove the carbon dioxide, and pump it back in.
So the machine literally breathes for the blood because the lungs cannot.
Yes. Because there is no cure for hantavirus. There is no licensed vaccine. Treatment is purely supportive. You are essentially just buying time and hoping the body can survive its own catastrophic immune response. This is why the mortality rate for HPS sits between 20% and 40%.
Man, hearing a 40% mortality rate combined with human-to-human spread and exposed passengers scattering across the globe, it is incredibly easy to feel a knot of dread in your stomach. Especially now. I mean, COVID-19 really left humanity in a permanent state of biological anxiety. We are psychologically primed to see every single outbreak, every localized cluster, as the immediate prelude to a global pandemic.
The psychological scar from the last few years is profound, for sure. As noted in the essay The Invisible Frontier that we reviewed, our modern environment has conditioned us to fear invisible threats because we all recently lived through a worst-case scenario.
Right.
When the public hears virus and quarantine, the immediate assumption is lockdowns and closed borders. But public psychology and epidemiological reality are often operating on two entirely different frequencies.
Well, and we see that in the official response. Because despite the terrifying headlines, global health experts are prioritizing very calculated containment over broad, sweeping restrictions. I mean, the CDC activated a level 3 emergency response, which surprisingly is actually their lowest tier of emergency activation.
Right.
They aren't shutting down international borders or halting trade across the Atlantic. They are focusing purely on hyper-localized quarantine and aggressive contact tracing.
Because the mechanics of the virus dictate the response. People ask, why aren't they shutting down airspace? Well, because hantavirus, even the Andes strain, is not highly airborne in the way a respiratory virus like COVID-19 or influenza is.
It doesn't just flow through a grocery store or linger in a subway car.
Exactly. It doesn't sweep through entire cities on a breeze. The level 3 response is entirely about tracking known closed-loop exposures. The goal is not stopping community spread, because widespread community spread with hantavirus is biologically unlikely.
We are seeing the global political apparatus actively monitoring this, though. Impartially speaking, former President Trump mentioned he's been briefed on the situation, noting it, quote, should be fine and is under control. We also see politicians like Senator Rubio closely tracking the international response. So the highest levels of government are definitely awake to this. But I do have to push back on the containment strategy for a second. If human-to-human transmission is so incredibly rare and it's not highly airborne, why did the European Center for Disease Prevention and Control, along with the WHO, mobilize such a massive cross-border emergency response?
Yeah.
Are they overreacting to public panic, or do they know something we don't?
They are reacting strictly to the math of the mortality rate. When a pathogen kills 3 or 4 out of every 10 people it infects, you do not wait to see if it mutates further. You do not wait to see if a secondary infection chain manages to take hold in a densely populated urban center.
You crush the cluster immediately.
You crush it instantly. The massive international response isn't mobilized because health officials think the Andes strain will sweep the globe tomorrow. It is mobilized because the cost of a single missed case is a highly probable, agonizing death. Epidemiologists are treating the severe consequence of the virus, not just its transmissibility.
It's the severity of the fire, not necessarily how fast the wind is blowing.
The perfect way to frame it.
But here is where the reality of this virus gets far more unnerving for the average listener. Because the cruise ship is this dramatic, isolated microcosm of vulnerability. But the vast majority of hantavirus infections have absolutely nothing to do with international travel, the South Atlantic, or the Andes strain. They happen right here in our own backyards.
Yeah, the true risk lies in the mundane. If you look at the Cinnabar virus in North America, the transmission vector is not another human being. It is the simple inhalation of aerosolized rodent urine droppings or saliva.
Right, from mice.
The deer mouse, the white-footed mouse, the rice rat, These rodents carry the virus without ever getting sick themselves, and they just shed it continuously into their environment.
And the trigger is something most of us wouldn't even think twice about.
Yeah.
You don't need to be on some wild expedition in Argentina. You just need to open up a rural cabin for the summer. You decide to clean out a garage or a shed or a barn that has been closed up all winter. You walk into that stagnant air. You see some dry mouse droppings on the concrete floor, and you naturally just grab a broom.
And using a broom on dry rodent waste is one of the most dangerous things a person can do in that environment.
Think of it like a biological landmine. The trigger isn't chemical, it's mechanical force. An everyday chore instantly weaponizes the air around you.
Because the viral particles are microscopic and they are preserved within the dried proteins of the rodent waste. When you use a broom, or worse, a vacuum cleaner, you apply intense mechanical force that shatters those dry droppings.
So it just blasts it into the air.
It launches millions of invisible infectious particles directly into your breathing zone. They hang suspended in the stagnant air of that enclosed space. And as you breathe, you pull those particles deep into your terminal bronchioles, bypassing your upper respiratory defenses entirely. Standard hygiene practices like sweeping and vacuuming are actively lethal in this specific scenario.
So how do you actually sanitize a space like that without putting yourself in an intensive care unit? Because the CDC outlines a very strict wet cleaning method. You don't just walk into a dusty shed and start working. First, you open all the doors and windows. You let the space cross-ventilate for at least 30 minutes to clear out any stagnant aerosolized particles. And you put on rubber gloves and a mask.
Yes. You have to eliminate the risk of aerosolization completely. You take a commercial disinfectant or a freshly mixed solution of 1 part bleach to 10 parts water, and you heavily douse the nest, the droppings, or the dead rodent.
And here's the crazy part.
Right. The critical step is that you do not wipe it up immediately. You let it sit for a full 5 minutes.
What exactly is that 5-minute wait doing to the virus on a molecular level?
Well, hantavirus is an enveloped virus. It is encased in a lipid envelope, essentially a fragile layer of fat that protects the viral genetic material. The bleach solution actively dissolves that fatty outer layer. Once the lipid envelope is broken apart, the virus simply disintegrates. It becomes completely inert and incapable of infecting a cell.
Wow.
Furthermore, the liquid soaks into the dried waste, trapping the particles so they cannot become airborne when you finally apply mechanical force to wipe them up. So after 5 minutes, you use paper towels, seal them in a garbage bag, and throw them away. You mop the area afterward, but you never, ever sweep.
Waiting 5 minutes for bleach to soak into a concrete floor sounds so tedious for just cleaning out a shed. But when you remember the cytokine storm, the degraded endothelial cells, and the drowning sensation, 5 minutes of patience is an incredibly small price to pay to avoid an ECMO machine.
It is literally the stark difference between a clean garage and a devastating medical emergency. And honestly, it brings us back to the core philosophical reality of our relationship with the natural world. We surround ourselves with technology and concrete, convinced we are immune to the dirt and the dust. But hantavirus is a harsh biological reality check.
It forces us to recognize that humanity is not separate from nature. We are deeply physically entangled with it. We remain incredibly vulnerable to the biological world. And that matters to you, the listener, whether you are traveling across the South Atlantic on a luxury cruise ship or just popping open an abandoned shed in your backyard to get the lawnmower. It's not about living in constant panic or assuming every mouse is harboring a global pandemic. It is about maintaining a deep, abiding respect for the invisible boundaries of nature.
Because when we disrupt those environments, whether it is on a massive scale through international travel and expansion, or on a microscale by simply sweeping a dusty floor, we are interacting directly with ancient ecosystems.
Yeah.
These environments harbor organisms that have existed long before human civilization, organisms we are barely beginning to understand.
We built a high-tech fortress, but that fortress is still sitting squarely in the middle of the wilderness. Which leaves us with one final, slightly unsettling thought for you to mull over. As climate change alters global weather patterns, and as deforestation and human expansion push our cities deeper and deeper into untouched wildlife habitats, how many other ancient dormant pathogens are currently resting in the dark, just waiting for a disturbed breeze to wake them up?